conversation today will be with people who work in care homes or people who have family members in care homes. And I would like you to address directly the suggestion that you could have done things differently. I almost wonder why you bother some mornings speaking to people that run care homes and learning that it was the complete absence of leadership from central government that prompted the lucky ones to move early, lock down before it was required, and source PPE because they'd been following the news in Spain and Italy rather than listening to what was coming out of the Department of Health and Social Care in the United Kingdom. And even now, they can't agree on what the line is. Or maybe it's deliberate. Maybe they put two lines. Maybe they inflate two great big barrage balloons of balderdash so that we don't know where the truth actually lies. Boris Johnson suggests that care home chiefs and, by association, care home staff bear responsibility for the spread of COVID because they failed to follow the correct procedures. Downing Street comes out an hour later and says, oh, no, that's not what he meant at all. Nobody knew what the correct procedures were. Which kind of leads inevitably to the question of why tens of thousands of people died in UK care homes and not in care homes anywhere else in the world. Because if there really was any confusion, lack of clarity, or absence of understanding of what should be done, how come everybody else got it right and we got it horribly wrong? How come all of the governments that provided really detailed, lengthy guidance haven't presided over a death toll like this, whereas the governments that told you to use British common sense presided over a death toll that remains, sit down, the third highest in the world? Oh, and the Prime Minister that doesn't like gestures was clapping for them on Thursday and kicking them where it hurts. Clapping for them on Sunday and kicking them where it hurts the most by Monday tea time.
Why did the government not provide PPE, sufficient resources and guidelines to care homes? I think the only logical conclusion is that they were attempting to protect the NHS because they had insufficient PPE, they had insufficient resources, because they had made bad choices in the years prior. Instead of buying PPE, replacing out-of-date material, they had a lack of resources available and they had to ration what they had available on hand. Now, when it came to deciding who would receive this PPE and these resources, the choice was stark. The choice was, do we provide these resources to the NHS or do we attempt to divide them between the NHS and care homes? Now, because they were insufficient even for the NHS, and because the NHS staff have trade unions to defend their position, to defend their rights, the government was under tremendous pressure from the unions to protect NHS staff. Now, unfortunately, in care homes, there isn't this same level of protection for employees, and in many cases, care home staff are paid a lot less than NHS staff. So they didn't have the same protections from trade unions. And unfortunately, I think, and this is a horrible thing to say, but I think in the public eye, they were regarded as something lesser than the NHS, as something peripheral. And when push came to shove, the NHS won out. The NHS received the PPE, or some of the PPE that they required. And unfortunately, the care homes were left to use whatever resources they had available. Care home staff resorting to plastic bags as gowns to deal with COVID. Care home staff using hand sanitizer from supermarkets instead of the proper ones developed for the medical industry. And finally, the most damning part of all was that infected patients were moved out of hospitals and into care homes. So you were moving infected people into a non-affected area. And of course, this caused a spread. And a great number of people died because of this decision. I think this is going to be a dark chapter that's going to remain with us for the foreseeable future. We're going to look back and ask, how could our governments be so callous to such a vulnerable group of people? Let me know in the comments, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot. Why not become a Patreon and enjoy access to our Discord server where we share news, chat, and have some fun? If you become a patron, you can also make video suggestions on topics that are important to you. Check it out via the link in the description.